Good evening, everyone. Hello. Adriana Barros here, certified BodyTalk practitioner, coming on without notice, last minute. I wanted to do a group healing session for ADHD, and people are still getting to know that I'm on. So basically, for those who don't know me, I've been doing BodyTalk for over 10 years. BodyTalk, if you've never heard of, is a holistic healing method. It is actually considered a holistic healthcare system. And it is so complete that it really looks at the body on all levels. It addresses everything: physical, emotional, psychological, spiritual, and it is all about bringing on balance and communication within the body-mind, making sure that all systems are functioning properly, communicating properly, and that the neurons, the brain cells, are sending signals, messages into the different systems in the body 24/7. And if these signals are not high, strong enough, fast enough, the body can start developing diseases along the way, which is due to the lack of communication. And this lack of communication, good evening, everyone. Thanks for joining. And this lack of communication, if not addressed fast enough, can then have the body start developing more serious conditions. And the fact that people only pay attention to what's going on in their body when things show up in the physical body is just because they tend to ignore all the signals that are given to them prior to that. When something shows up in the physical body, it's because things on other levels of the body have been already happening long ago. And the fact that you just keep pushing through and ignoring the messages, that is a big red flag. And when people usually go check on something that's going on with their body, usually that's been there for months, if not years, and oftentimes too late to do something about. And then people usually try and get a massive dosage of medication, multiple medications, which are not really addressing the root cause of what's going on in the body. The body really functions based on surroundings, everything that works, that is functioning around us or not functioning around us. So the environment is crucial to what's going on in our body-mind. So our interactions, our emotions, the situations, the violent situations, the neglect, the abuse, everything that's going on in your surroundings is the main cause of everything that's going to affect your body later on in life. So technically, for those who don't know me, I specialize in trauma release and healing. And I'm also a certified BodyTalk practitioner. I do 2 other modalities, which is angel healing, whose the main focus is on mental health and general body health, but it's a very good tool to be used on mental health. And the Table for Accelerated Prosperity, which is a prosperity tool not only focused on money and abundance when it comes to really money, to acquiring money, but it's also abundance on all levels of the body. Everything that you consider that you would like to be abundant of, that's good for. The BodyTalk is the tool that I actually tested before to see if it would be the most appropriate for tonight's topic, which is ADHD. BodyTalk works directly on the brain. And it's really about resetting that communication, the faulty communication, but addressing also emotions, addressing what's going on and what's not really functioning in the body-mind. So ADHD, which is attention attention disorder, hyperactivity. Where did I get a blank? Did I get my ADHD going on? So anyways, so the attention disorder, the hyperactivity, attention deficit hyperactivity disorder. Thank you. So what happens when you experience ADHD is people usually have pretty much the same symptoms, which is really being hyperactive, not being able to sit still, to pay attention, to focus, and to get distracted very easily. So your attention is not there. Try and read a page of a book, or read multiple pages of a book. You just get so annoyed and you just take off. You just can't be there. So it does affect your memory as well, because if you can't focus, you can't really memorize, and so you start having problems if you're in school, if you're at work, if you have to produce, to be proactive and productive towards what you're doing. So it tends to be very distractive, and you start losing interest, and you just can't be there. You can't do things for long periods of time. You have to usually break down, and this is because there is this hyperactivity in the brain of neurotransmitters in the brain, that there's the dopamine and neuropinephrine that actually they control the focus and attention in the brain. And if these neurotransmitters are really working at a lower speed, and the brain is going to start not responding accordingly. However, so this is one side of the story. So in order for you to have more of those two components in the brain, you usually are prescribed medication, so you can increase the availability of these two, the neuropinephrine and the dopamine in the brain. However, it's not only increasing the quantity of these two components in the brain. You don't want that only to happen, because if that happens, you can still function for a certain time, but usually you go back to square one. And why is that? Because ADHD usually is diagnosed in children, and children is the childhood period is usually where you get more of the traumas that you've lived in your life, like the heaviest ones. Usually in the first 7 years of age is where you experience most of the traumas. And that's when ADHD is diagnosed. So usually if you experience trauma at an early age, what happens is you start trying to take off. You don't want to be there. You don't want to be in that situation. You don't want to be in that environment, and you will have difficulty paying attention, handling. You just try and escape as much as you can. And that's when, if you are given medication, you will start responding better, but on and off, that reset is going to happen. So the trauma is going to kick in again and again and again and again. That's why it's important to clear the trauma, the root cause that made that happen to the child, whatever it is that she experienced during her childhood years, even at an early age as a baby, or even before she was born. That needs to come out. That needs to come to surface. It needs to be cleared, so there's more functioning happening. So the neurotransmitters are going to start functioning at the levels that they have to, and the neurons are going to be sending stronger signals into the systems, and you will have more on point brain communication, so you can focus more. And so the symptoms will start subsiding, and you're not going to be going back to where you once were multiple times. So today I wanted to do this session for you, which is the BodyTalk healing session for ADHD. And also because BodyTalk, as I said before, it works on the brain, and it really looks for the root cause and does that clearing so well. And I wanted to have this done under this perspective. So if you guys are here because you experience ADHD, or you have someone in your family that experiences that, if that person is in the room, just leave the person there or listening to the session. You can tell them, of course, that this is happening, but if not, as long as they are listening to it, they also receive the benefits of the session. So for BodyTalk, you don't have to do anything on your end. I would just suggest that there's no distraction around you. So turn off your TV, radio, telephone if you can. If you're on the phone, then just make sure you don't take on any calls and make sure that you just focus on what's happening. If you want to be lying down or sitting, whichever is most convenient. If you're listening to this session after it's been recorded, I would suggest that you do not listen to this while you're driving or operating any machinery or anything that requires a lot of attention from you. Just make sure you are on receiving mode, okay? And that's pretty much it. So if you want, follow me for this. There is a main technique in BodyTalk, which is called the cortices technique, which is the balancing of the two cortices, which is the left and right cortex in the brain, which is basically resetting all the functions within the two hemispheres. So everything that's happening within the brain, when you tap the cortices, which is the brain balancing in BodyTalk, everything starts resetting. So the communication within every single aspect of the brain is balanced, reset, reconnected, and the brain starts functioning at a better on a better level again. So if you want to practice and do that on yourself or on anybody at home daily, twice a day, morning and night, is a great way to improve your health on the long run, to improve your memory, concentration, focus, and to help really be more settled down in regards to ADHD, if that's the case. So just make it constant, just like put it in your phone, like tap cortices. And if you forget how to do it, if you look up transform therapies on YouTube, or trauma healing, trauma release and healing on YouTube as well, you can find me there. And just go down to the old videos and look for cortices and just follow along, okay? All right, so basically pick one of your hands and place behind just above the neck, on the base of the skull. The other hand is gonna be doing the tapping. So we're gonna be tapping the head, the heart, and the abdominal area, which are the three brains. While you're doing this, take deep breaths, and we're going to do the tapping of each hand position for 2 breaths. You don't have to count how many times you tap, but just make sure that as long as you're deep breathing twice, you're tapping at the same time. Once you've done that twice, you move up 1 hand position, and we're going to cover the whole brain, okay? Go up another hand position. Usually if you yawn during the tapping of any brain position, is because that brain position needs more attention and there's some sort of an imbalance there. So the cortices lowers the stress levels, number 1. If you're really nervous, agitated, can't sleep, if you try to focus and you can't, or if you're really nervous about something, or you just had an argument with someone and you just, you know, you can't calm down, try and do this on yourself, and you see you get back to where you were before. So you see, I've covered all brain positions, didn't leave a space in between, none of them. So just to make sure that all brain functions are being addressed, okay? Now we're gonna do the emotional brain, which is the limbic brain. So place your hands like this, just above your ears. Let go of one hand at a time, doesn't matter which one, and tap. Anchor again, and let go of the other hand. You guys yawning on your end too? All right, and that's it for me. If you're still tapping, I'll give you a couple of more minutes. I'll take a sip of water. No, I'm not tired. I just explained why the yawning happens. It's because if there are black spots in the brain, if there are spots that are not communicating properly, it's the body readjusting. So it identifies where you need more attention in which function of the brain. Or if I'm doing a BodyTalk session and I'm tapping the session onto someone, and if I yawn, it could be also that I'm picking up the energy of the person who's receiving or the people who are receiving, and I yawn as well. See? When I decide, or a client decide to receive a BodyTalk session, the session starts when the person decides, commits to doing or receiving a session. So oftentimes it's happened a few times that people book a session, and when they come to me for the session, they tell me that they are fine, they don't need the session anymore because the symptoms are gone. So that means that the day they booked the session, the commitment they made at that point, the body starts the healing process from that point on, not only when it's being done. So your session, this session has already started when in my head, I decided that I was going to do a session for ADHD. So it could be that I'm picking up the energy from the collective, which I do a lot when I'm doing sessions. All right, so I'm going to start. Hold on a second. I don't know if I want to put this here. Well, let me put this here anyways. Oh my God, now I won't stop yawning, see? Anyways. Hold on a second. I'm just trying to open a new page here. All right, so you focus on your situation, your symptoms with ADHD, whatever it is that you experience more often on that symptom, because that's what's going to start shifting for you after the session, okay? Oh my goodness. And I even started the session like per se. But anyways, ADHD. Okay, just enlarge this a little bit because it's too small. Give me a sec. Just put a bigger font. There. All right. we're going to start with circulation nerve supply to bring more or to take out the excessive blood flow from a certain body part. It is the brain, so we are doing the circulation within the reptilian brain, which is the survival mode brain, which is also the brain connected to, starts in the, it's right here in the cervical. More specific. So more specifically, we're working on the C4. Oh my goodness. I want to close this, but I can't even close it. Oh, here. No details here. Link. Okay. So we're working with the environmental. So things in the environment, okay, which is going to be different for everyone, but I'm picking up on certain energies here. It's grief that's coming up. And it's asking for details on grief. Childhood years. Okay, I'm picking up on somebody's energy. I don't know who it is. Mother leaving the home. Some mother walked out and abandoned the family during somebody's childhood years. Okay, something outside of body talk is coming up. Okay, so as far as I understand, this mother never came back. And what's coming up outside of body talk is for the person to look for the mother, try and track down the mother. Most likely because there's been no contact. This is a very specific message, so. More circulation of supply. Okay, in a system. Nervous system. So we're doing the circulation of supply within the nervous system. So now we work with the 5 senses. With sight, of the right eye. And it's a physical issue, not an emotional issue, but something on the physical level. affecting the right eye. So whatever condition, somebody specifically with that right eye. Other systems, again, something outside the body talk. Get your eyes checked. You probably need a replacement glasses. Now we're working with the musculoskeletal body. We're working with the spine, like center, like a thoracic spine. No details, so the whole thoracic, no vertebrae in particular. Five senses again. Hearing, right ear, it's not a physical condition, it's a subtle. So meaning whatever is affecting the hearing, it's on a subtle level, and it is due to emotions. It's nothing on the physical level. So usually, if you have some impairment in one of your five senses, let's say it's the hearing, okay? It's something you have to ask yourself, what is it that I don't want to hear? Because your body starts protecting you from what it is that your command was. You said you don't want to hear it. So what's the only way to not have you hear something? Is to stop hearing. So it's a very subjective way of looking at things, but this is the body psychology in body talk. So it's a self-defense mechanism of the body to protect the individual to not experience anything that they don't want to go through. So then, of course, the body develops other problems, right? But it's in lieu of the fact that you said that you didn't want to hear it. So when you change your perspective, right, towards a certain situation, then your body starts adjusting. That's the consciousness of the body. Another link, okay? We're working with the musculoskeletal body one more time. Second group, we're doing mouth to navel. All right, we're doing, okay, there's reciprocals are balancing of two sides of the body, and this can be left, right, front to back, upside to downside, like diagonal, left to right, and so on. In this case, we are balancing a certain pair of reciprocals from the second group. And in this case, for those who don't know, this is what I use to do a session in Body Talk. So this is the protocol chart that allows me to navigate the body and find out the areas of imbalance that need attention. So in this case, I am working with these groups here, which are the musculoskeletal groups. So we're doing no surprise there. Ear to axilla. Ear to axilla is something like this. Okay, so these 2 points are reciprocals. So we just talked about the 5 senses, right? The hearing and the eyesight. That it's a defense mechanism. So the right ear with the left axilla to balance the hearing, most likely. No details. So we're gonna do a sub-session on this part of the session. So we're gonna go into depth of the hearing. It wants me to address, actually wants a sub-session on the urinary system. So the urinary system is from where the body eliminates toxins, right? Either emotional, physical, ingested, smelled, skin contact, any toxin. So we're working on the urinary system one more time. More specific. Some symptom, some stinging. Somebody who's been experiencing stinging when urinating. Other systems, something outside body talk that's coming up. To drink cranberry juice, which is good for urinary tract infection. So another link in the subsession part. Urinary system again. No specifics. Just a connection I want to make here. When we work with urinary system, it's connected directly with the kidneys. The kidneys are related to fear in Chinese medicine. So for somebody to have all these imbalances with their urinary system, there's fear being held up in the kidneys that needs to be released. event came up, which is part of something in the environment. Which is a future event, something that hasn't happened yet. And there's fear connected to this future event, right? That is to come. It's asking for details, but because it's the collective, I don't know if I can identify the fear. Okay, I think I was able to. It's fear of meeting up with the mother. Remember I said that someone on here has lost contact. The mother has abandoned the family, and it came up in the BodyTalk session that we're doing now, that the person would have to. It suggested that the person try and find the mother, but then there's fear of looking for or finding the mother, which can be causing all these imbalances in the urinary system because of the fear I told you connected to the kidneys, right? Okay, so we're going to end this subsession. We don't have to go back to the main session. Is implementation a priority? Yes. Satellite. When there's a satellite, it's something bigger above you that is influencing, interfering with your living, with your condition, with your life at this moment, what's going on. So technically is a separation. Let me see. It's actually the mother. My God, whoever this person is, I don't know, but it's picking up on a lot of this dynamic. And just so you guys know, it doesn't mean that the session is for this person. It means that it's prominent because of whatever is coming up, but whatever is happening here during the session is good for everybody, okay? Even though there's no specifics to your situation during the session, you're still receiving and it's still going to work for you, okay? Hold on a sec. So the satellite of the mother. So yeah, so the satellite is the mother who's not present, but it's there. So what does that mean exactly? When there is a satellite, it's a matter of, it's a fact, it's a person, it's a situation that affects you, even though it's not in contact with you, because it's something that your life revolves around. So it's the fact that this mother is not present has influenced your life big time on all aspects. And it's still influenced to this day because there hasn't been a contact, there hasn't been a closure, right? So that's what a satellite does. It really influences your life big time. So we're going to go with a parallel session now. So this is a session that I've been doing. Now we're going to work with a secondary session beside this one. skeletal system. So now we're working on bones, okay? Structure. More specifics? No. So the whole skeletal system, no details, okay? So nothing more specific to it. We're back in systems again. Urinary system one more time. More specific. Okay, so specifics on urinary system. All right, this is regarding reduced urine flow. So when you're peeing a lot less, okay? Even though you might feel that you need to go, but there is no release, proper release or emptying of the bladder. No, nothing more. No links, okay. Parallel formulas to a priority, no. Forwards, yes. Breathing, deep, exaggerated. Okay, so I'm about to tap this formula, and you have to take exaggerated breaths, okay, which is much deeper. So if you want to join me, you can tap head, heart, and abdomen area, enteric brain, and take deep breaths while doing this. So we are really integrating this whole session, all this formula that's been created. I'm just following my instinct here. I have to tap more on the heart. This is just my intuition, because the body needs to absorb all this session. It needs to really take it in deeply. All right. Other systems, again, something outside body talk. My goodness. Let me see what. Okay, it's still about that person. Look for your mother. Try and find her. Got in contact. You know, you need to talk. There's a whole lifetime to be sorted out. That's your session. Oh my God, I'm getting goosebumps now. For some reason. So that was the energy of this ADHD session. although you might think that nothing related to ADHD came up specifically in the session, what did I say in the beginning before the session? That ADHD is not, it's not a set off on the physical body. It doesn't start in the physical body. It's about trauma. And why are we talking about this mother? And there's a big trauma related to the situation that is causing this ADHD thing in this person or whoever else. But to her or to him could have been the mother, or to you could be something else, but it doesn't matter. The main point here is it's not the physical body that suffers. It's your emotions. It's your trauma that needs to be released when you experience ADHD. That's the whole point here. Okay, and I keep saying, and people who follow me on TikTok, and if you see my posts, my videos, everything is trauma. Everything that you live, that it's based on, that you experience, all the conditions, all the problems you have, everything is trauma based. Everything. On different levels, but it's everything related to trauma. So until you decide to release those traumas, things are going to keep sticking around for a wee little while. Or for decades, for that matter. So it is a matter of addressing your personal situation. Whatever it is that you're dealing with, whichever your trauma is, needs to be addressed for you to move forward in life. Otherwise, you'll be always stuck to the past. And that's not good. If you're stuck in the past, nothing happens, nothing manifests, you don't move forward. You can't become who you want to become. Pretty much that's all it is. Okay, so if you want to listen to this session again, you can. You don't have to, because it already ran its course, but I'll put it up again. I'll upload it actually, and so you guys can review it, share with other people, whoever needs to, are dealing with ADHD, whoever you know, just share it, that's my token to try and help people, because I understand there's a lot of people struggling with everything these days, and it's just a matter of, do what I can. I do what I can. If it's something on the personal level that you guys want to deal with, then book your private session, and then we can address your trauma from the root cause, whatever happened then. And I keep saying, if you want to do group sessions, join some people and, reach out. We can do group sessions as well. But keep working on yourself. You don't understand if I tell you how many years I've been working on myself. And I'm much better, but I'm not done. Nobody's done. If you're done, you're not in this body anymore. But you have to do the work. I will die saying this. If you don't do the work, nothing changes. My cats are going crazy here right now. You better stop. Anyways, so just wanted to share this with you. I hope you enjoyed it. And drink lots of water, okay? Water is a very good conductor of energy and releaser of toxins. So drink that water, because we touched a lot on kidneys and urine, right? And bladder. So drink water so all that negativity, all those toxins can come out. Okie doke. And if you don't follow me yet, Transformational Therapies, it's Transform Therapies on TikTok, on Instagram, and today I changed my name on YouTube. The Trauma Release Healing Therapist. But I might change it again. But anyways, you'll find me. Okie doke. Anyways, any questions, send me a DM on TikTok. Or Instagram if you don't follow me there, and I'll be glad to address it. Okie doke. I hope you enjoyed it. Have a great night, guys. See you next time.